Ladies and gentlemen, the current pandemic brought the health matters to the top of our priorities. Good health is an essential component of our lives. But health is more than that. It is also a precondition for the prosperity of our societies. Healthcare plays a prominent role in our economies. It accounts for 8% of the total workforce and for 10% of the value added we create each year, the GDP. It is not a small industry, it is a large basic sector. The European Investment Bank, as the EU bank, supports the policies of the European Union. Hence, supporting healthcare projects is part of our daily work. We aim to ensure universal access to high-quality and affordable healthcare services. In 2020, we accelerated our support for healthcare. We target the drive for treatment and for a vaccine to tackle COVID-19. The pipeline for healthcare and related research and development projects amounts to 6 billion euros. The projects approved throughout the year focused on critical health infrastructures and equipments, but also on research and development of vaccines, treatments, and diagnostics for COVID-19. I can proudly mention you some prominent successful examples in this field. We financed BioNTech and CureVac to develop a COVID-19 vaccine, and let me tell you, with success. BioNTech brought to the world the first COVID-19 vaccine. The so-called Pfizer vaccine is in fact the vaccine developed by BioNTech and produced jointly by BioNTech and Pfizer. Also, Pluristem, Atriva Therapeutics, and Immunic benefit from EIB funding for developing therapies. The pandemic challenge goes beyond cure, treatment, and vaccination. Also, digital healthcare gained a very large prominence during the pandemics. It simply plays a crucial role in ensuring operational health resilience. The investment needs in digital healthcare are now more unquestionable than ever. They are a key part of our crisis response mechanisms for the future. From contact tracing and warning apps to electronic vaccination scheduling and digital certification, from online medical consultation of chronic diseases to sharing patient data across hospitals, from coordinating the supply chain of medical equipment and consumables to other protective gear, including logistics and the distribution of masks. IT networks and digital technologies showed how indispensable they are in delivering efficient and effective crisis management solutions. At the bank, we did our best to respond quickly and timely to these needs. To ensure the eligibility of various electronic health components as part of our COVID-19 response projects. This applies to digital health, telecommunication systems, and to equipment, but also digital health surveillance, diagnostics, and modeling solutions, and to mobile applications, IT equipments, telemedicine solutions, or voice bots. In 2020, we supported numerous health sector projects. In the public sector, I'd like to highlight the support to the COVID-19 response in the Republic of Italy and in the region of Madrid. In the private sector, we supported players like biopharmaceutical companies at the forefront of developing the next generation immunotherapies. To conclude, I'd like to express you our firm commitment to funding digital health developments. We have sound in-house expertise composed of a strong team of engineers, health economists, and legal experts and banking officers. We know these projects take time to deliver. Returns came farther in the future, if they ever come. We know these projects bear high technological risks, and returns, in fact, may never come. But that's exactly the reason why EIB was made for. A very patient lender, a lender that can wait for returns that come farther apart in time. And we can bear risks in our balance sheet. We can share technological risks with the private sector companies to crowd in private investors and to make this project bankable. Digital health developments play a key role in a better and fairer distribution of healthcare to our citizens. And that's the key driver. That's what motivates us. This is a key step in the direction of a fairer, more united, and more solidary Europe and solidary with the world. The beneficial effects of digital health for our society ensure that supporting projects in this area creates social and economic value added. That's of a paramount importance. I leave you now with Auvo Kaikkonen, Senior Life Science Expert, and with Marcin Golec, Senior Health Economist. Their work makes us very proud at the EIB. They will provide you the best insights on the EIB activity in this field. Thank you very much for your precious time.
Good afternoon, ladies and gentlemen. On behalf of the Life Sciences and Health Division of the European Investment Bank, we would like to present to you the EIB, tell you how we see the current investment needs in the digital health area and how we try to meet these needs. Firstly, I would say a few words about us. We are the world's largest multilateral borrower and lender. We are the only bank owned by the EU member states, and we provide finance and expertise for sustainable investment projects that contribute to EU policy objectives. 90% of our activity is in Europe. Since 2007, we have invested in many companies with more than 12 billion euro in the life science projects, and in the public sector, 25 billion euro in the overall healthcare sector. If you look at the right-hand side, you notice that there is a lot of activity in 2020 projected for 21, and this is of course because of the ongoing COVID-19 pandemic. Next. The EIB investments in the healthcare sector include providing funding for infrastructure, equipment, medical research and digital health solutions, both for public as well as private stakeholders, which provide healthcare services to the population. In the life sciences sector, we have been supporting projects for RDI, technology transfer, industrial scale-up and process optimization. These projects are initiated by companies specialized in biotechnology, biopharma, medical devices, e-health or diagnostics. We have observed that the role of digital solutions in all these sectors have been growing and continues to do so. EIB is a policy-driven bank. Our principal policy is to support developments which create new assets in EU, be it tangible like hardware or infrastructure, or intangible like R&D. We see the following cost categories as eligible to realize this goal in digital health subsector. Over to you, Marcin.
What kind of investments need we see in the digital health? In terms of size of the project, we see large scale, often multi-billion investments, which countries and other stakeholders are incurring in order to establish electronic health records on a large scale, on national scale, often electronic health records with additional functionalities. And such large-scale investments we see as investments which allow to obtain maximum benefits for the society. And an example of such investments, such projects supported by the EIB is digitalization of the entire Irish health sector, supported by us in the project eHealth Ireland. Scarcity of structured medical data is currently one of the major reasons, major obstacles hindering development of e-health and digital health applications and slowing down medical research. Reliable structured patients' data are necessary to develop digital health solutions and to conduct medical research. And the availability of such medical data is limited due to a number of reasons: legal, organizational barriers of access, fragmentation of databases, lack of sufficient interoperability between electronic health records. We observe a whole plethora of ideas and solutions how to address this scarcity, this hunger for data. And we are ready to support these efforts which address this which increase availability of medical data in a proper way. The example of such project which we have supported is IndiviMed Global Cancer Database, the project which links from one side omic data, molecular data, and from other side clinical data, and which aim to facilitate, to accelerate cancer research. Another area which has been noticed, identified by us as requiring investments, is education of, in terms of digitalization, is education of medical professionals, medical education, and medical research. We observe huge investments needs regarding digitalization of medical curricula. This includes e-learning, but also medical simulations. And these are sometimes very often very technologically advanced solutions like haptic simulators. And the same is true for medical research. Basically, without digital tools, nowadays this is not possible for medical researchers to keep up with the front line of research. And the institutions in these areas which are rich in human capital are not necessarily rich in financial capital. And here we are to support these valuable stakeholders. And an example of such support is Warsaw Medical Simulation Center in Poland, in which we have invested and helped Medical University in Warsaw to establish state-of-the-art development. Last but not least, each and every investment in hospital which EIB has been making during the last years, and this is only increasing curve, contains significant digital component. Basically, no hospital nowadays can be built, established without the digital backbone, which is hospital information management system. But this includes not only financial accounting or electronic health records. There are also massive, more and more telemedicine solutions, e-radiology, e-pathology, or some very advanced concepts like hospitals without wall, smart hospitals. And here the examples are, as I mentioned, basically all our projects from north, from Finland, like Jyväskylä Hospital, Kainu Hospital, to the west, National Children's Hospital in Dublin, to the Central Europe, university hospitals in Poland, in Gdańsk, in Lublin, hospitals, university hospitals in Romania, in Iași. As to conclude, the EIB sees the investments needs in e-health, digital health subsector. We are ready to meet these needs. And if your organization, your institution, your hospital, your university is in such need, please feel free to contact us. We are here to help. Thank you.